You're live.
Good afternoon, everyone. The Jefferson County Health Board Trustees meeting, for August 24th, 2023, which is 4:01, I believe. PM. Before we begin, I want everybody to please mute your phones or shut off any other device that you may have so they don't have interruptions. I will call this meeting to order. Need a roll call vote.
Mr. Pig,
I'm here.
Mr. Beal,
Here.
Ms. Little. Here. Dr. Henry. Here. Ms. Davis.
Here.
The quorum has been established for the Jefferson County Health Center monthly business week. First order of business is reading of the Jefferson County Health Center's mission, vision, and purpose. Mr. Neal, please do so.
There. Mission of the Jefferson County Health Department is to champion positive health outcomes and behaviors through innovative programs and community engagement. Vision of the health department is advancing the health and safety of Jefferson County. And the purpose of the health center, as included in the current revised Missouri state statutes, is Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Great, thank you very much. Next on the agenda is approval of the agenda. We have a motion to approve the agenda.
So moved.
Do I have a second?
I'll second.
Is there any discussion on the motion? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. I believe we have two guests sitting in the audience. Welcome. I know people signed up to talk later, so we'll continue forward. Next on the agenda is approval of the July 27, 2023 meeting minutes. Need a motion to approve.
Make a motion, we approve the minutes from July 27 meeting.
Do I have a second?
I'll second.
First and second, is there any discussion? Not hearing any, all in favor, please say aye.
Aye.
Any against? Motion carries.
I was saying,
I'm sorry, you abstained?
I was.
One abstain. Thank you. Have one abstention, all right. Now we have the approval of the July 2023 expenditures for $247,931.67. Do I have a motion for approval?
So moved.
I have a second.
Second.
Having first and second, is there any discussion?
Mr. Chairman.
Yes. Okay.
Okay. There's several things that stand out to me in these expenses from, July the 1st to July 31st. First one being, the cost, that our architect is charging us at this point. I know we've paid him quite a bit so far. I am interested what's been paid so far. Does anybody want to talk to head Steve right now? What have we paid him up till this month, not including this one?
Well, up to this month?
Yeah.
I think it's. Well, the latest I have is $394,635. Where we're at.
And that's not including this.
That would be, this is the last bill, which includes one that's not on here. So it's one more.
So everything on here in addition to that. So, I just want to bring this to the attention of our board. What Steve said, and then another additional $119,339. And from what I understand, we don't even have a set of blueprints that we can look at. I think that's a lot of money. I don't know why we didn't try to get prices from other architects. Either bid process. Okay, well.
We went through that.
They went
It
through
was-
bid
it was
process.
Prior to the stidham.
She was a part of the process.
As well.
Okay.
It was.
But we, the bid that he gave us, I did not know that it was this high. So if it is, it's still high.
Roughly in the neighborhood, $10 million project. That's not, at this point in time, that's not really out of bounds of what we bid for. So we bid for it. There was a committee there. We all went through it. We approved do that. I
Uh,
went forward on this.
I probably, I'll go ahead and move forward. So I think we need to keep an eye on that. I think we need to keep our options open as we go along. Check with other people to see what their big project costs them and see if we're in line with that, with what we're paying for our architect.
Okay,
As we go
hold on.
along.
We went out, we did a competitive bid as is required. On doing the architect, we're also doing a competitive bid as is required, going through the RFP process. For the building of the project, that's required, so we're already doing the competitive bids. There's nothing that's happening that's not above board, on target with the law of the state of Missouri.
I understand that, the next step is going to be that we're going to put bids out for contractors to build this building. But what I'm saying is this gentleman has gotten around $400,000 or more of our money, and we need to have a set of blueprints. We need to, be still open to whatever we want to do. In fact, maybe using some of the contractors that we want to contract, the hired contractor to be the general, and not have to have them involved in what this seems quite expensive. So anyway, that's my comment, and it's just a comment, okay? So that's on record. The next thing I'd like to pay attention to here is some more costs that we are spending or asking. $2,200, $700, $3,100. The total on that. On this invoice is it's about 720, 810, 15,000, 8,000, or 8,200, 709, and 3,100. So there's a lot of money. I understand that Aspen program is going to move over to a not-for-profit and a separate entity. But this is still a lot of money that we're spending, and I like to bring that up because I'm elected to take a look at these kind of things. Okay, and the next thing I'd like to bring to our attention is the cost of our legal fees. For Chrissy Coleman, I'm noticing her bill sits in front of me, and we're not broken down into where all these hours came from, but she's got an invoice to us for $392, $832, $2,908, $336, $1,400. That adds up to $5,800, and then she billed us on the 5th of July for $2,900 and $33,000. So 35 added to 6 is $41,000 in 1 month's time. I think excessive. I don't think that we as a board should allow such a thing. I think that we should put a limit on this.
You have a question?
I do not have a
You're actually
question.
making statements, but you-
I don't have a
You
question.
make a question if you have one.
I have a motion.
Okay, what motion you have?
I have a motion to hire Christy Coleman and get a new attorney.
Not on the agenda.
Not on the agenda. We'll put it on the agenda.
Yes, sir. Sure. So, to clarify and this was also clarified within Ms. Davis's packet, the $5,800 and fees that were related to JCHD activities and for governance, general counseling. The two other legal fees that were mentioned, the $29.96 and $33,500 were both legal fees for Aspen. And again, all of those are covered by grant funds, those were contracted services. So the legal fees are not, they were legal fees over the course of, and I want to look at it, I apologize, it was several months. But this was in July, they are 2 years.
22 and 23, right? Those 2 years.
Yeah.
And we're just now getting a bill because.
Because it was a flat fee project and we didn't bill it out to the completion of the project.
And who proved that? The board approved that? Who proved that amount?
The amount was negotiated between the health department and my firm for the flat fee for the, as part of the grant, Gasman program.
Doesn't the board have to approve those?
No, the board doesn't pre-approve legal services.
That seems to be a problem.
So there should be an invoice, PO 39318 for. Aspen legal fees for 22 and 23. We should see an itemized detailing of what this $33,500 entails. Minimum.
Those are voids available for as all records are available to the now. Again, as I had mentioned before, Aspen has been completely funded by grants. There's extensive tracking, applications of that program, and if those kinds of things are asked for prior to a board meeting, they would be accessible for your review.
This is
Without
already been
having to
asked.
put us on a.
So I would like,
Mr. Chairman,
is there any other questions on any other subject?
Mr. Chairman, I'd like to address something that Kelly just said.
We're gonna move on. Is there any other questions you have on the bills?
I would like
On the
to make,
motion,
I would like to make a statement. We're discussing this before we approve it. Okay, and the final thing I want to say is this. Grant funded or not, when our employees that we pay highly for had to take their time to go search for these grants and get these grants brought in and bring them in for this quote Aspen program that has been our director's pet project. Now there's at the end of this, since they're getting ready to switch the Aspen program over to a not-for-profit now. All of a sudden, our attorney comes up with $33,000. Oh, by the way, we only $33,000. So this just needs to be on record. I don't think this is okay, and I think we need to do something about it.
I'm gonna call the motion to vote. It is the approval of the 2023 expenditure, $247,931.57. All in favor, please say aye. Aye. Any opposed?
Myself,
And myself.
3-2, the motion carries. Next on the agenda is approval of the 2023 electronic payments, $505,376.63. That is the electronic payments. Motion for approval.
Make a motion.
my second,
Coming in first and second, is there any discussion? Not hearing discussion, all in favor of the motion, please say aye.
I,
Any opposed? Motion carries. Number 4, pre-approval of the September 23 electronic payments for $600,710.52. Do I have a motion for approval?
Make a motion.
I'll second.
Number first and second, any discussion on the matter? All in favor, please say aye.
Aye.
Any opposed? Motion carries.
my vote was an aye. I'm sorry.
Was it aye? Was it?
Yes.
Positive? Thank you for that clarification. Next on the agenda is director's report. Ms. Palmer.
I think if you all have had the opportunity to review the report sent out previously, the beginning of my report will begin with the mission moment. We are looking at this month, our part of the trend in your receipts. Letting people know that part of the receipts are protection for infants and children manufacturers. Young are off the meeting. Because it's really important that people choose the right part date for the right age. A couple of statistics from the National Highway Traffic Safety Administration: 325 children under the age of 5 were saved by car seats in 2017. 40% of children killed in car crashes in 2021 were unrestrained, and 46% of car seats and booster seats are used incorrectly. I provided the NHTSA website in case people would like information on finding the right car seat, installing their seat, but as well, I wanted to bring light to a program that we have here at the health department that has trained staff on site that we can provide car seats and we can direct installation for those who qualify. And with that, I'm going to pass it over to you.
Hey, Tim, I'm so sorry. Could you do me Mr. Pig, could you do me a favor and just click the toggle? The TV has seemed to turn itself off and my HDMI, there's a little button there. It feels like a little, a Nintendo, just push it right in. It sometimes takes a second. Yep. Please work. Thank you. I apologize for the delay. The tech is messing with me here a bit. Let me make sure our viewers at home can see. Sorry about that.
Hi, my name is Megan Winkleman. I'm one of our health educators and also one of our certified car seat technicians. We operate a program in conjunction with the Missouri Department of Transportation and Cardinal Glennon Safety Department. So this program is for families within our community who may not otherwise be able to afford a car seat. To be eligible for this program, you have to be on some type of government assistance. So we receive a lot of referrals from our partners over at WIC. Children are only eligible for one car seat per their car seat life. Pregnant women have to be at least 38 weeks along in a pregnancy to receive a seat. And then whoever is making the appointment has to be the primary guardian of the child. So we do have a lot of foster families that come to us just because it can be hard for them to find seats that are appropriate for the size and weight of the child, and also safe for them, so not broken or coming from someplace that they don't know the car seat history. So we're able to provide them with a seat. So these seats that we receive are brand new, and they go to these clients completely free of charge. Everyone who comes into their appointment receives car seat education on how to properly install the seat into their vehicle, and then also how to adjust the seat to fit that child perfectly. So last year we gave out 84 of these seats and checked 90 seats. That 90 includes the 84, so that means we checked some seats within the community as well as the seats that we gave out. This year, we've given out 56 seats and checked 61. So we're only halfway through the year, so we'll probably be closer to that 84 by the end of this year. But like I said, all of our clients receive education, and so on average, there has been a 22% increase in their knowledge about car seats and car seat safety after coming to their appointment. So we really enjoy putting on this program because we can get children into safer seats to ride around in our community and not have that barrier of cost, especially for families who may not be able to afford them normally.
Next item, I'm just gonna highlight through a couple of things that are within my report, letting everybody know to remind folks, our second town hall will be held on September 14th at Hillsborough Civic Center at 6 p.m. We did have a new building town hall on August 9th here at the Health Department, where it was attended by the building committee, administrative team, and architectural firm. We had no public attendance, and there was data monitoring. Going through mobile wellness. Wanted to follow up on the report that we had from last month about the mobile wellness van being involved in an accident. And at the current point in time, we are continuing wellness activities. Those have been adjusted to be able to go out through our director vans, as well as to be able to work from the site to ensure those activities are still going on. But once we received feedback as far as the insurance company and the current joint van, it is the recommendation that we either sell or trade the current unit and update for long-term sustainability. A initial grant has been submitted that we will find out a little bit later this fall to put towards $250,000 of an anticipated $450,000 for a new vehicle. There's also an additional $200,000 that's being requested on an expansion grant that we're receiving some additional funds So we will keep you updated on that. We just want to ensure that folks were aware that we're looking into those opportunities and planning for sustainability. As far as staff recruitment, again, just kind of, I want to bring to the forefront of the board that we are having ongoing difficulties with getting candidates for our clinical and non-clinical positions. The main reason cited for not accepting interviews has been this offer salary is lower than the market rates. We do plan to have a compensation study made in the next quarter to evaluate salary and market rates for our positions. But in the meantime, two direct impacts of not being able to fill this position is we have had a lot of scheduled overtime work for office support and our public health nursing staff in order to cover the back to school immunization schedules and as well a community response. And then as well, the adult dental program has had to stop taking patients off a waiting list. The dental program has been stretched to meet the needs of adult patients and youth during the summer months due to staffing shortages. Schools are starting, and with the school rotations, we're going to put a hold on the adult list to ensure that all of the adults who are currently providing services to receive complete care plans and allow them to have our staff transition back to their schools. Our current wait list for our adult patients is 65 people and it goes out to November for adult patients. Just giving everybody an update, and within the report, there's updates on the pending national litigation regarding opioids that the criminal department joined with Jefferson Dispute. We'll have some updates there. Letting you know that we resolved a dispute with Windstream, who is our data and phone providers for the High Ridge office. With early termination fees, they initially wanted to charge the health department in excess of $96,000 to end the fees end service early. We worked with them, and the final savings to the health department was $73,000. So the early termination fees were reduced to $23,000. So it resulted in $73,000 difference from what they originally came to us with. We also received a refund from the County of Jefferson for overpayment for our election costs. Just bringing this to your attention because it was 27% increase over what was budgeted this year. Our portion of the April elections was $125,800, which we had anticipated $100,000 within our budget. We do have another election next year, so we anticipate needing to budget a similar amount of $127,000 to $130,000. The reason that our costs are that large are because of the fact we are a county entity. So all of the groups that have elections, they split the cost of the election by the population that is served. So since we serve the entire population, we take on a larger chunk of the cost of their. Finally, just wanted to let you know that within your books, I included information on the Missouri Supreme Court ruling, which allows counties are now permitted to intervene in nullifying, are now permitted to intervene in the Robinson case, which was the case that we looked at taking or eliminating certain public health authorities when it came to being able to be government places something that is correct. But basically at this point in time, the original court had made the motion that the counties of St. Louis and Kansas City, we were also one of the counties that intervened, did not file in a timely manner. The Supreme Court came back and said that these counties, including us, did not have time to, or did not have any reason to believe that the lawyer for the Department of Health and Senior Services for the state would not file an appeal for them on their behalf. And so because that didn't happen, the Supreme Court stated that it will be remanded back to that court, the initial court, to be reached. It has the potential to be retried, or but the counties are able to intervene at this point in time and ask for that to be retried. So,
Very good.
okay, I was like trying to make sure I got it all kind of safe in there. But in the meantime, what that means is that we have had some questions. Our communicable disease with justice. The other thing that's included in this is a report from later publications. In terms of the Midwest High Intensity Trafficking Area has recently released a 2023 overdose report from Missouri, and it lists Jefferson County as the fourth highest in Missouri for overdose mortality. Counts regardless of the blood type. So yeah, just reminding everybody, this is a big issue in our area, one we're continuing to try to work with partners on. And if you'd like additional information, that's included. With that, I'd like to turn it over to Melissa Farley, who will be introducing our clinical focus report.
What can we do as a board to give these positions? The clinical, I'm sorry, yeah, the clinical part. I know that's the pay I would think about. So what can we do to get these positions filled? I mean, we're not servicing the people.
Well, I mean, I don't know what you need to come with a suggestion, what you need to do, we need to be going to move forward. If it's dollars, then, I mean, obviously we can go through and find out where we're at compared to other health, these health departments, our size in the area. I mean, obviously, you know, all the guys get what you do. Obviously, I'm sure you're going out and advertise.
What's it paying?
So for an RN, it's 23, and for RN, US
Starting RNs are making.
Oh,
Yeah, that's what I'm like. Yeah.
it's not just nursing. I mean, we're also having that issue in dental as well, with our dental assistant positions, and environmental. So I just wanted to say that, across the board, for my staffing, I know that that's a concern. That's why I think this workforce, the salary assessment is gonna be really important
For the next quarter, that's
Do an assessment on themselves.
what, like, that's still 3 or 4 months out. Right, I mean, if you do that, I mean, you're still waiting more months if you've been months without one. I know this has been an issue when I first came on board.
It's been an issue for us for
So we are looking at within the next month, but they said, I can't. remember.
6 to 8 weeks.
So
So we will bring, once we have that, we will bring.
let's.
But I just want to make sure you.
Especially short term, that's what you work with the personnel.
Okay.
Understand. Move forward, things like that, if you're okay. with
And
it,
it, I mean,
like
contract travel. I mean, we can put like a travel position, you know, and pay the piece amount, get them in here for 8 weeks to help, you know, with all the back to school stuff.
So we did look at that at one point. The cost for the travel nurses really
It's
expensive.
expensive, but you need
Really expensive. The problem that we run into is to get them trained on some of our program details, because we do so many services across the board. We have used them before to come in and like, we have a PRN nurse that we're gonna use for our flu vaccines. We have PRN nurses that can help us with a subset of those clinical services. But what these ladies do across the board, it's almost a year of training to get them up on what they can
Anything. Oh, that's great.
Mr. Deal,
The health department has a finite budget that's based on, the, mill tax. And the only way to increase that is to take it to the voters for an increase, and it seems to me that folks in general these days are not interested in doing that, so.
Another way would be to cut budget somewhere else, right?
Cut down on legal expenses, cut down on the architectural guy. We can make money for these.
I have the floor. The other way is to look for grants, which a few minutes ago, we were being chided for doing that. So, you know, folks need to understand that, okay, if we want to increase the budget, we can try to do that. But we need people's approval to do that, so that's one issue. Every healthcare organization these days is fighting for employees, and we have tried, I appreciate everybody's suggestions and things that we can do, but I think folks need to understand, we've probably already done all those things. But, you know, certainly, we should discuss it, see what kinds of, outcomes we have. But
Thank you, Mr. Gill. I want to move this back up before we drifted way off topic again. We got to stop doing that.
Thank you, sir. Well, before I introduce, two of our clinical nurses who are going to be talking to us about our family planning program, I wanted to see if you had any questions about the clinical report that's in your packet. Great, okay. Then I'd like to introduce Emily and Kate. Kate is one of our nurse practitioners for our family planning program. And Emily helps coordinate our family planning program with the state. Again, we follow our federal guidelines. So these ladies are going to talk a little bit more about what we do through that family planning program.
All right, so if you like to be off topic, I'm Kate. And I like talking, but I brought my bag of tricks, and I just wanted to say thank you all for being so kind and being on this board. If you're not aware, they're gonna but thank you for running for an unpaid position and putting yourself out there, because I have one more. Because we know it's a thankless job, and we know you don't get paid, and we know you put in tons of hours. But I've been here for 14 years, and I truly appreciate everything you do for us, because if we didn't have you, we wouldn't have our jobs. And I really do appreciate everything. So quick.
So number one, our Title 10 program is a federal funded program since 1970. The goal of this is to offer quality care.
I don't know when, you gotta tell me.
Oh, yeah,
I was gonna say,
yeah.
tell me when to go.
Yeah.
So we want to offer these services to our community, mainly for low income and underinsured patients. We see people that have health insurance as well. But the whole goal of this that came up years ago is to reduce barriers to healthcare that people that would otherwise not get.
Emily, I'm just gonna give you a little feedback. People are saying they can't hear you. Gotta speak a little louder. That microphone is touchy.
Loves when we're speaking. All right, so next slide, our Title 10 services program. So Title 10 does lots of things. Patients oftentimes know that we do birth control, and we do counseling, and they can get their supplies on site. We do pregnancy testing, we do all the STD testing and treatment. We do counseling about, getting pregnant and what that looks like. But when you are involved in a Title 10 program, there are a ton of questions that get asked, and we don't just ask the questions and then leave them hanging. So I always talk about wraparound services. So when patients are asked about things, we try to get them the resources that they need.
So next comes this program called The Right to Dying. The goal of this program is to offer free birth control, completely free. It offers their visit that day if they start birth control is also covered. It's a 6-year program. We're in year 5, so we end March of 24. It's to overall improve information about and remove barriers to contraceptive services. And the biggest takeaway to that is people can choose whatever birth control method that they want without deciding if it's too expensive or not. And it supplements Title 10. And I think the overall goal of this program was done is for the Title 10 services on a whole mission to learn how unintended pregnancies affect our patients and continue to offer services that decrease barriers.
So Title 10 has always been, it's been a fantastic service. This the Right Time initiative is like the icing on top of it already, really pretty cake. The initiative, when they first started talking about it, I got super excited because at the health department, we had several of the methods, but usually the lower cost methods. With the right time, we were able to add the more expensive methods because they were funded. And so we were able to add every single method that was out there. So IUDs, we were able to add the patch, the neutering, and all of those methods. And ultimately, when patients are given the option of whatever method that they want, and cost is not an option, whether they have insurance or not, they it's like, their choice, whatever they want. And right now it's interesting, but the most expensive method that we have is the patch. If you look at what it costs month to month and what it costs for, every 6 or 8 years, the patch is. And we're only one of 9 agencies in the state that offers Title 10 and the right to. So, kind of a neat little unit.
So again, with the rules of the right time, we want to reduce health disparities. I just want to add a quick note in about maternal health care. Overall, our rates in maternal morbidity and mortality is pretty low throughout our whole nation. And if you add in unintended pregnancies on top of that, that's not how you get great outcomes. So yes, adding on top of that.
When you talk to, when we talk to these patients, I mean, a lot of them are moms, and being able to offer them the potential to space their pregnancies, or that they don't have to worry about the cost of their birth control method. And if they wanted to push something off 6 months or a year, and we're going to be here in a year, we can talk them through whatever that looks like, is huge. It's giving them a choice, and that's, to me, an amazing, very empowering position to be in.
Okay, and so then lastly, we want to talk about our emergency contraception kits that we have. We offer them for free for anybody in our clinic, anybody that we see, and then anybody in the community that comes in, males or females, and we call it AC for short. The background noise of the emergency contraception kits is to offer education to everybody, to know what's legal in Missouri, what's not legal. And we talk about wraparound services, that each kit has also information about making safe choices, being in safe relationships, condoms, and then of course the
just giving patients that option to use, if they've had either like unprotected sex or underprotected sex, to use, a form that's legal, that's safe. And obviously we want them to know the call if they have questions or concerns, we can be accessible. Looking at our program and in numbers, we do a lot of things. Depo is our biggest method that we provide on site. We do a ton of collection of data. And so with that data collection, we get information back. Gonorrhea and chlamydia screenings are huge. We do a ton of HIV and syphilis testing, and information about that. We just take right back to patients and say, the more you get tested, the more we can find out. The more we find out, the more we can treat and be able to know more and do better. So.
And this just kind of goes over the demographics of patients. Most of our patients are female. The biggest takeaway, I think, is that 35% of our patients are uninsured. So we offer services to about 35% of people that would cover what happens.
And we try to talk with them about what it looks like to get insured. So my goal with patients is for them to understand how we can partner with the Jefferson Franklin Community Action Agency to talk with an insurance navigator to either see what Medicaid looks like, what does marketplace look like. I try to go on every so often and see if I can navigate it. And a master's degree and a bunch of years of experience, I can't usually figure it out. So I always say, go, make an appointment with people. I call every so often and see how long it takes for them to call me back. Sometimes it takes 3 weeks. So trying to have a, boots on the ground understanding of what the services look like. We update our referral stuff weekly, monthly. It's not just a, dusty sheet of paper that, we hand out. We try to be very real with folks. And, when we talk about our patrons, we see generations here. So we've seen the grandmothers, we've seen the mothers, we've seen, the daughters. And to me, that speaks very highly of the health department. I didn't come from this county, so when I learned about this county and the services that they offer, I thought it was odd. That people would go to the health department, because where I grew up in Middle Missouri, people went there for death certificates. And when there's restaurant complaints, but Jefferson County has got a very robust program, and it's amazing all of the things that happen in a short period of time that we get. Appreciate the support of the board and our directors, past and present. If I don't say so myself, so. Anyway, yeah, any questions?
They still doing follow-up on HIV and syphilis cases?
HIV, yes. Syphilis, as much as they can possibly, yes. They give us a lot of guidance. Emily is on the horn all the time right now. Lisa's on the phone with them trying to get guidance. I would say right now, I was only alive in the 70s for about 6 months, but it was like the 70s all over again out there, because we had a ton of syphilis and trying to navigate like their the contact circles and making sure that folks can find out about, like, we can get you tested, we can get you treated. But we've got to make sure we have the right information. It's huge, and sometimes the staff in the Eastern District is not near big enough to do all of that. So we do a lot of, help support them. So yeah.
Where is it?
Big time awareness. And just, I mean, like Kelly was talking about, I mean, people use like needles, that you might, back in the olden days when I was in school, people looked like they use drugs. You can't tell who uses drugs nowadays. You can't tell who might use, any kind of an IV or morning straw. And any of those folks could easily, pass things along. And so we see syphilis in places that people might never think about. So I tell folks, if you think you've been at risk, get tested. It's just a blood draw. You don't have to like it. It's, some people don't like coming here. I give you full permission to not like it. Come anyway. We're not that scary. So, and we'll make it, as pleasant as possible. And, results come back pretty quick compared to back in the old days. So yeah, it stays electronic now, so we can get in and look up results, and not always wait for mail. So yeah. And it's free. The blood testing is free.
Thank you.
Yeah.
Thank you. Again, I cannot think about enough of our clinical staff. They have, it is definitely, while they serve a phenomenal amount of people, and as you can tell them, they are very busy with clinical services.
Many of them are the other departments.
So then our clinical staff, she just walked out. I was gonna say they're nursing. And then medical systems are in that testing. I will get you. But what I was just gonna say is, when it comes down to it, the staff that we have in that program, they take the time to ask those questions, and they take the time to research the background services. So just as you said, they'll call over to the community action and find out how long somebody who's the right person for them to connect with, and they do that personal that handoff. And I'm like, that is something I think that is unique to our services. So I really think that is true. The community services report, Dina, is at a state emergency management agency training today. And so her report is contained within your packets and was mailed out. So I'm going to move to the communications report with Brianna.
Perfect. Okay.
Switch to.
Yeah, the chairs, I know, I did it. I messed up the chairs. Everyone in the public and watching it home. I messed up the chairs. She will not do it next time. God is her witness. Okay, this is gonna be trouble. All right, so let's go ahead, go through the health communications board report really quick. Got a couple of things here in your packet, and then I have some videos that I want to show, because why not? First thing in there is the Jefferson County Health and Education Fair. It's the big back to school fair that is kind of like a huge partnership within the county, usually hosted at Jefferson College in Hillsborough. And we are
honored to participate every year. We had lots of programs and services that were there this year. Mobile wellness was there, dental, our teen coalition, lead education, the drug prevention coalition, and children and youth with special health care needs. So according to the folks who put that on, his VRA kind of has that up. 245 families were served, and there were 568 children that were in attendance that were provided school supplies at the fair. They get to kind of stop by and get all the goodies and talk and get to hang out with parents and, you know, provide some education. So that's always a really good event. We also submitted for submitted a proposed, I just realized it's spelled proposed wrong, so that's cool. Work plan and budget for OD2A. It's a current funding stream that we already have. It's grant funding and just looking to extend that. Part of those, part of that work plan would really just continue the harm reduction strategies, which includes the naloxone distribution and education, mostly working through community collaboration to let folks know what overdose looks like, how you can prevent overdose, and you know, the resources that are out there in the community and the surrounding counties. Smoothie bike and nutrition events, we did a lot of those. We did 134 smoothies total. Did anybody on board get one? Was anybody at one of those events?
No, I didn't ask one.
No, but we do that, I saw off.
All right, I'm gonna find the next one. I know, right? I do need to do that. I'm gonna get the next one that we have on there, and I'm gonna have Kelly email it to the board.
Yeah, I want to wrap.
So you guys can all go. The Teen Coalition vaping campaign was one of the things that we worked on. I'm gonna actually pull that because Sarah, it's here, we have a video to show you. So I'm gonna skip through that one and come back to it. Perks Employee Engagement Committee, we've been working through kind of our employee wellness policy, or not policies, plans here. We set up challenges once a quarter. So that's always kind of fun. That's most of the people throughout the agency are, we've got a little representation from everyone, so to speak. We were in lots of community events and meetings again. You can read that part. We're continuing to work on our workforce development. The Public Health Foundation updated the core competencies for public health. So we are looking at reassessing our staff based on that. And then that'll kind of give us an idea of the trainings and the things that we need to move forward as, you know, we look towards 2024, 2025. Our organizational development specialist has been working on conquering that beast, and it is in fact a beast. So kudos to Nikki. I talk really fast too, so just interrupt me. Okay.
Go ahead.
Oh, okay. Well, I'm pretty much done here except for the team baking one with the video, so I'm happy to answer questions.
I always notice on our reports how high the dog bites are in Jefferson County. That is a huge problem. What are we doing to address that on our website or our Facebook page? Can we give people information? Hey, if you have this kind of dog, please do this.
That is a great question. I will definitely add that to our program plan. So I can say that animal bites, we hit it, but not nearly as much as we hit other things, right? So sometimes that comes down to like grant funding as far as deliverables. Short story. Thank you for the feedback, and I'll be sure to add that onto our campaign plan.
And it's the highest number
Yeah.
on all of our reports.
So I know that a lot of like the animal bite inspections and stuff, and I'm dropping names here, but like Sarah Wilton is our FE, and her and Scott, our vector guy, have been kind of working a lot with like the ticks and mosquitoes recently. But definitely we can throw some more education on there about animal bites.
Just as an FYI, I'm sorry. just
No,
to-
go for
to further that, there was something within, I believe, the last year that the tracking system or the reporting system for animal bites was altered. And so I think they're capturing more than they have in the past, so it seems like there's been a major increase. It's not to say that there hasn't been an increase, we're still figuring that out, the trends, but that is one of the reasons why it looks like they've gone up so much.
And just in general education about even what our animal bite program is could be good too, because I think some folks, know we do mosquitoes, and sometimes, they ask us questions about ticks, and we get the occasional bed bug question, which our vector program loves. But yeah, definitely, because you think animal bites, we mostly think dog, but there's other animals that are people are friendly with, and still not friendly with. So definitely an opportunity for education. Thank you.
Yeah, and just to make sure all people understand, the county has an animal control program, which is separate from a health.
Yeah, true story. And I think actually a couple of the municipalities have, or cities have their own too, because I know Arnold
has their own individual, so, and Scott, our person who does that, he knows everybody in that realm, like when I get an after hours call, I'm like, hey, I don't know how to do this, like, oh, just call so-and-so. I don't know who so-and-so is, Scott, that's your, you give me their number, and I'll take care of it. So I'm gonna step off the podium here for a second and give Tara the opportunity to chat while I load up our video about our vaping campaign. She heads up our teen coalition, and this was their brainchild, so.
The word you used was vaping.
Vaping, huge problem. There's probably like
Was that right?
more teenage slang out there that I am not going
Just wanted to hear.
So-
Sorry.
So I'm Tara Halter. I'm a prevention specialist here at the health department. I'm also coordinator of the Jefferson County Teen Coalition. So the Teen Coalition is open for youth from middle school to high school. So basically 12 through 18 years of age. We are open to every school in the county, private as well as homeschool children. We actually have a homeschool
Sorry.
in our coalition. So are you ready?
No, I'm sorry. I am just loading things up. You keep going.
So we actually have a baby.
You might get another one.
And the social campaign running right now. We're in the Summer School District.
I tried to warn you this time. I'm sorry. I know.
I'm gonna say,
Then I get to go home.
Okay. We're in the Soder School District, we're in Hillsborough School District, we're in Segment High School, we're in Fox Middle School, we're in Ridgewood Middle School, we're in Festus Library, and we're just wanting to get out there more. You know, so if you know of a school organization that would like to be a part of this campaign, what we do is we provide all the materials and educational materials free. I wrote a $5,000 grant to our local PRC, which is Prevent Ed. We received the $5,000 or close to $5,000. I purchased locking baking disposal boxes, which are basically locking mailboxes. We give those to the school, as many as they want, basically. So like if the high school wants 2 or 3, if they're a bigger school, and the middle school wants 2 or 3, and then the alternative wants 1, they get them. We provide them those locking boxes, we provide them educational flyers, we provide them kind of flyers that go in the bathroom stalls, but we laminate those so they don't get messy. And then they put all of this educational material throughout the school. It has a QR code that goes to our website. We've got a baking educational page on our website. It's got a tab that's for the youth. It's got a tab for caregivers, and it's got a tab for, we call them youth advocates, because we understand there are more people than just teachers that work with you. So it's broken down, and it just gives a ton of free educational resources for anyone who works with youth or anyone who wants to just stop, you know, vaping, because it's just, it is a problem, and it's out there in the schools, you know, the school can say it's not, but it's out there at the college. I still trying to work with the college. Their student care coordinator wanted to use this program, but they had a committee that said they should not do it on the college because it promotes it, but it's there. When I'm there on the college, meeting with people, I see adults and youth vapers on the college campus. So if we can just get out there, it's a great program. And I want to say it was youth led. I just work with the teams. I give them a place to meet. I feed them pizza, but all the ideas that they come up with, it's definitely them. And these videos, I will say the kids.
Yeah, they did a really good job.
About them.
Yeah.
Nan and I were kind of skeptical. We were like,
I taught middle school.
they're gonna come and not have anything.
Yeah.
Yep.
This way.
Well,
Will you come to a church if they invite you?
I'll go with anywhere. Well, let me preface that. I'll go anywhere. But yeah, yes.
When they make the babes look like highlighters.
So vapes can be made to look like highlighters. Vapes can be made to look like lipstick containers, energy drinks, anything.
that's my
Hoodie
husband.
strings.
Fun fact.
Yeah.
What
Okay.
happens to the items that are put into the lock boxes?
So, great question. So we are partnering with Walgreens and Arnold for Richardson and Vogel. They are letting us use their medication drop box. And we take them up there, whether they're, there's typically a point person at the school. Because once we do, the goal is to get into every school in Jefferson County, and I'm one person, but they're letting us use that medication drop box, and then they environmentally safely dispose of those vapes, and everything for us. But yeah, it's a great partnership, and I just want to put a plug. Last school year, we collected 137 vapes. Through this.
All right, so this is one of the videos.
Did you know? If you did spend $50 on vapes a month, you could get 10 Starbucks tea drinks, 20 nugget meals from Chick-fil-A, or a tank of gas. You know me? Sounds like it's a pretty easy choice, right?
So that was one. Oops, there's my husband again. Sorry about that. He's gonna be super thrilled about that. Okay, and then here's the other one.
Do you ever feel like you need an escape from reality? It's called escapism, and it's a short-term way to make negative thoughts and feelings disappear without actually solving the problem. Escapism can come in many different forms, such as reading, writing, or even listening to music. But the most common forms, such as alcohol and drug abuse, are not the healthiest ways.
That's two of the actual youth in
Yeah.
our team coalition. We have other videos that the other
Yeah.
youth.
There's 5
Yeah.
videos with all of our youth, but I know that time's of the essence, so I just grabbed 2.
Youth wrote, filmed, starred in, they did everything in these videos. The only thing they did not do is actually edit them. So they are the masterminds, and this is the first time that our youth group has actually done their whole video. So I'll just talk about them. They're a great group of youth, and they did everything. Usually, the last time I did, or the youth did, a social media campaign, we paid an outside source. And I was like, let's give the kids a chance and let's see what they can do. And I think they did a wonderful job, and they deserve just so much credit. I'm super proud. I can't say that enough.
Thanks, Sarah.
Thank you.
I can hit the podium again, but that was all I had unless there were other things in the analytics. Anyone need anything from me?
Thank you very much. You want to back up on one thing, talked about earlier, cost of the architect stuff, just real quick, I did a quick search, and I knew it was a percentage, but I couldn't remember the percentage. And he goes on levels of how intense it is on a building project. But our building project, Steve, correct me if I'm wrong, it's estimated to be about $10 million, right? So it would be considered a very intense build out because it's money. So it goes between 5% and 8% through the nation from the least to the most. If we take that 7%, it would be like $710,000 on architect fees, when a legitimate percentage would be on the total build out. And that's things that I'm used to, because I think quite a few of them over with so it's not out of the realm for what they're charging.
And what we pay is part of it.
And I mean, everything's included on that. They're gonna take it to the beginning all the way through.
You said 5%.
It's not the lowest would be 5%. That'd be for a regular commercial building. Ours would be up more like 7%.
Okay, so
Which would be
5% is like 100,000, we're way over that.
Not.
So
7% would be $710,000. And that would be what you would be looking at, because a medical building is a lot more intense, there's a lot more to it, a lot more regulations going on. So I just want to tell you that that's all my point was. All right, we're gonna move forward.
we have 140,000 for 7%, just on 2 million.
In 10
million.
Don't worry about it. I got you. You're right, you're okay. You know,
You can't even build a house for that, even a small.
we're
We're good.
we're watching the dollars. I mean, Steve's watching them. I know Tammy is, I am, James was before. We're pretty good with that on it. Okay, so the next item on the agenda is new business, although it's old business. We don't have any old business. Next one's new business. Number 1 is adopt the Jefferson County Health Center Sunshine Law. If we remember, this was given out last meeting, regular meeting. last month, and we looked at it, and I told everybody to take it home. Look at it, review it, send me any thoughts, anything you want to change on it, send it to me. I received nothing from anybody.
I have it with me today.
Nobody sent anything to me as I requested, so that's home here.
Sorry, Keith.
I told everybody, please, if we're gonna send things home for homework, let's get our homework done. All right. So I need a motion to adopt Jefferson County Health Center Sunshine Law, chapter 610 RSMO policy.
So moved.
First, and second,
A second.
having first and second. Discussion.
Mr. Chairman, do you
Yes,
want to
ma'am.
go first, Tammy? or-
No,
Okay,
Can I ask?
all right,
Can I ask a
so,
question first? So, why is it titled this way? Does this be a resolution or what?
It could be a resolution or a policy. Like right now, we have a section for it in our bylaws. This is just a separate policy that kind of goes further into the process and procedures administratively for how they can go about handling the sunshine requests and getting those out.
Okay, I'm sorry. Okay, I'm sorry.
And before, again, I am gonna say, if we're homework, I'd like to get this done before we come here to revise things, but go ahead. David, you have
Mr. Chairman, several things here. A lot of this is just, it's what the law says already. We don't need a policy. But when it gets down to,
Let me clarify this. I thought we said we had, that by law, we have to have a policy on it, correct?
no, we don't.
Hold on, by law, we have to have a policy, correct?
Internally, we need to have it. We have it in our bylaws already as to what's exempted. If we want to talk about, where everything goes, how much our per page is, all of that, it's best to have it within a policy.
It's that we don't have to. So. Okay, so what really stands out to me is. I've heard this over and over and over throughout the community about how hard it is to get a sunshine request fulfilled at the Jefferson County Health Department. That it takes forever to get an answer. It goes to our attorney internally first, and then it comes back to our COR. And then literally, we need to skip that step. That's in here that we're gonna use her, the attorney, but we do not need the attorney. When a person makes a sunshine request, our COR, as long as it's not asking for something that is obviously not something we would produce, such as legal advice or employee information or people's social security numbers, et cetera, et cetera, et cetera. Very commonsensical. Our COR does not need to get a hold of our attorney. She simply needs to answer that sunshine request and say, yes, I'd be happy to provide this for you. This is how much it will be. Or would you like to come up to the Jefferson County Health Department? And what day would you like to come? We'll show it to you. And so that's this is what our law says. So this pops out at me. So it says we literally can come up here and look. And I'll show it to you if you need me to show it to you, but it's there. So we do not need to spend $225 an hour back and forth between the legal person and our COR. She just needs to produce. So if we're even thinking about voting on a policy, that needs to be stricken. We need to just have the COR take care of it. That's my first comment. Second comment. Okay, anytime any of our elected board members would like to look at something, would like to see something, there's no reason why our COR can't make an appointment, have us come up individually. Just for instance, have me come up individually, something I want to look at, get in her computer, do her magic, bring it up on the screen, let me take a look. Yeah, I think I'd like to have a copy of that, 10 cents and then, But as a servant of the health department, we're elected by the people and we're serving here. There wouldn't be a meeting without us. We have to be here. We vote. We don't get paid for it. Why not make it easy? If this is something that has been a pet peeve of mine all along. I've been given so much of a hassle. Anytime I've asked to see something, it doesn't have to be that hard. And so, and my next comment is. The cost, okay, when our COR is given a sunshine request for a document or some emails or whatever it is that she needs to produce. Then it's only gonna take the lowest paid employee of the department, a certain amount of times. She needs to give a reasonable cost and answer that email right away. Don't go to the attorney and ask her questions, have to wait for that response and all that crap. But take care of it as the COR. That's what her job is, right?
Sorry, the way plan is not have members of the public speaking with our attorney during.
I have a feeling that certain members of the public are here to address something about the sunshine law anyway, because they're very upset. They've been upset.
Well, I got a lot of things to do as well.
Okay. So good. So I know that there's been people talk about it, and wouldn't it be a great idea to have?
I'd really like to hear that. I don't believe what you're telling me, to be quite honest. If people are here to talk about it today, that'll be the first time I've heard it.
Please.
Okay.
Cite us for 25 of people with many complaints about.
Hold on.
sunshine.
That's been addressed.
It's not been addressed.
Yes, it has.
On the meeting to order, please, everybody.
Attorney,
Ms. Davis,
back and forth to the.
Ms. Davis. All right, hold on.
Totally.
I'm calling to order. I will clear the room. We will end the meeting right now. Knock it off, please. Be civil. Ms. Davis, you have the floor.
Thank you,
Keep
sir.
going. You're finished. We will move on to.
So- If we're even thinking about voting on this policy, which we really don't need to have, I'd rather just say don't do it because, you know, we have a COR to take care of that. But if we're gonna vote on a policy, let's define some things. Let's say that the COR takes care of it without talking to the attorney. Let's say that we don't charge anything, just invite the committee member to come up and see what they need to see, and that would take care of a lot. No cost. Hang on. Okay, and then another idea that I heard being discussed, in fact, John Gina Silva mentioned this. So why not have a computer in the lobby, or put it in here? And he said, why not have everything that's been produced in the sunshine department from our health department in that computer. And then people can come in, but yeah, it's already been produced. Here you go. You know, when the COR gets their letter, she can say, yeah, that's already been produced. If you want to come in, there's a computer in the lobby, come right on in. You just reference it in the search bar, it pops up, and you need copies, 10 cents copy. That would be really wonderful, okay? Or if there's something new that they need, that can be produced the same way. It can be put into that computer and the person could come up and see it at their leisure on their own time, etc. No problems, no arguments, no frustration. Everybody would get what they want and it would not be a big deal. Okay, so those are my recommendations. For now, I'm reading some of my notes here. There's a lot of the stuff in this policy that needs to be stricken. If we're even thinking about adopting this, I think we need to. If we're even thinking about adopting it, we need to go line by line, starting with page 1, 2, 3. Skip over page 1 and 2, but start on page 3. There's a lot of stuff that needs to be stricken before we even think about it.
I think it's rather not that it has somebody who is.
Hold your tongue, please.
Sunshine,
Director,
just so again.
Director. Please. Finish your statement.
Yes, sir.
Neil, do you have something you wish to say?
I just think most of what she said is either misleading or totally incorrect. Let me just say, sunshine law is a tool for people to use. If people have questions, if people want information, they do not have to file a sunshine request. They can ask a question and get an answer, and it happens all the time. And then if they don't get what they want, then they can file a sunshine request. Automatically filing a sunshine request is not always appropriate. But if you do file it, we have to file the state sunshine law. And this follows that law. And Ms. Davis, you're totally misrepresenting how this process works and what people are doing. I just don't know what to say. I mean, there is a sunshine law, we follow it. People don't have to use it. If you choose to use it, which they regularly do, then you get what you ask for. I just don't understand where you're coming from. I mean, we have to be held to the law, which we are, which we do. If we're not, then people have a problem with that.
Mr. I just have one thing I want to say, if we let the public speak, they can't.
They're gonna get their chance.
Before we vote, or even talk about any more of those, maybe they can. Enlighten us.
Neil, is there anything else you want to add? Dylan, you have something you want to say too?
Yes, we do. Trustee Deal, you said that Susie was making up accusations that there was a problem with the sunshine law. Do you want people to prove it? Well, I believe there were multiple complaints to the Attorney General just last year, the year before, whenever it was before I got here. There were complaints about it. So yes, people are saying that they're not getting what they need. So that's
We're not-
very dismissive to say of her when the information was there from the Attorney General. Okay, well, whether or not, no, it's my turn.
It's been addressed.
I didn't, it wasn't disputed whether or not it was addressed or not. I'm saying there have been complaints. There have been complaints, just saying. So you can't say that it's dismissive and it's not there, because it is there.
They haven't been brought to us.
Mr. Neal, please.
No, it's gone to the Attorney General. Past us.
Continue on.
Now, as far as the sunshine request, this who originated to update, whose idea was it to? Who wanted, where did this come
I
from?
brought the sunshine policy to the board and that we received questions from the community about how we are processing sunshine records.
Okay.
This is a specific format which explains how we operationalize sunshine law within 4 walls of this department. Nothing that is in that sunshine policy is outside of the norm for any government. Ms. Davis, I have.
Please stop, guys. Ms. Davis. Please. Continue on. The question was asked, being answered, please do not interrupt.
So this was in light of complaints. So the other complaints, that's why we redid it.
I apologize, I didn't mean to interrupt, but no, that was not in my plan. It was just that we have people asking for sunshine and how we do it. So we were trying to put it in within a written policy.
Okay. So what did we have a written policy before this? Or did we go strictly by Andrew Bailey, is that our name? By his,
The state of Missouri sunshine law.
We have-
always,
We have it in our bylaws, so we've gone by our bylaws. The reason for the policy was to essentially create a one centralized document or place where the public could go. Because if you privily put on the website, to say like, this is how we do, this is how we fulfill these. Because we get questions about like, well, how do you do a search or how much does it cost, those types of things. So to have one document where all that information is, it wasn't the result of complaints, it was the result of questions about how do we handle those requests internally.
okay. So two things I have a problem with. Or, how long have you been doing that? How long have you been the collector of records? Yeah, that's. Okay, and I'm just asking because I didn't. I think you're very good at your job and what you do, and at least preparing my. So my question is, I would think that she would be able to make the decision of whether or not you need to ask for legal counsel on the question. I personally feel that she's confident enough in her job to handle these requests without every single email going to our attorney, which we're paying $250, $280 an hour. So that's not part of the law. That's like an insert in here that everything goes to Ms. Pinkley, to our attorney, and back to Ms. Pinkley, and then back to a constituent. So that is not part of the law. That is a money grab, in my opinion. Because I feel she's very confident.
But I appreciate, sir, if we would not say a money grab. You
I
are
apologize.
insulting my staff.
She's not your staff.
She's my staff.
No, not
And
her.
you are
No,
saying
no,
that-
she's insulting me.
I would say you that.
On,
Who wrote it? Did you
I
write
did,
it?
I did not,
I
ma'am.
wrote it down.
I did not.
put the information together from pre-existing policies, so if you have an issue with it, please bring it.
I
civility,
do. With her having to see everything.
Can I say something? That before Chrissy was ever our attorney, sunshine request went to our prior attorney.
Okay. And have they been doing that this whole time then?
We had all the sunshine requests always went to the attorney. Long before Chrissy was our.
And do you really feel a need that you couldn't answer
I
any of
wasn't-
these?
I
without-
wasn't the company of record.
And actually, she takes the first draft of it. And I usually, she sends it to me, basically say, is there any exemption that I'm missing or should something be pulled under the exemption?
I mean, unless it falls under the couple things that can't be public knowledge,
There's actually-
everything needs to be available.
There's actually quite a bit that can't be public now.
Can I make one other clarification, is that when it is sent to the attorney's time is not, we cannot charge for the attorney's time.
Correct, that's correct.
The only time that is charged on a sunshine request is the average of our lowest paid staff member who is capable of filling a project. I will tell you, we've never charged for higher than one of our OSA, which is our lowest clerical staff. I will tell you that 3/4 of the things that have to be pulled by upper management or the executive director. That's not a $16 an hour position. That is a position that we are losing money every time that you are charging for $16 for somebody to do something. I'm sorry, I'm just saying, we don't charge for these people. We don't charge.
I'm not saying, but she
gets paid, to look at it.
yes, she does.
So,
If she gets an email, she charges the health
Charges
department.
us.
She might not
Yeah,
charge
the
for the
department.
sunshine. But she charges the health department to read the email and stuff.
Yes.
We pay that. The taxpayers pay that for everyone. My point being, but I think she does a good enough job. She could, if she has a question, by all means, but I don't think every single one needs to go to our attorney to, that's why we have such legal. My other question is that we're gonna deny, if someone makes a sunshine request and for whatever reason, they don't pick it up, don't pay for it, whatever, then they're never allowed to sunshine again. Is that how I'm understanding that? Is that even legal to do that?
No.
Is it legal to tell a citizen that because you didn't come and pick up a $20 sunshine last year, that you can't request again, that'll be denied? Is that legal?
They can appeal it to the board, they can appeal it to the director above the COR. The reason for that request is that we had a requester that incurred several $100s worth of staff time and never came to pay for the things that he requested. So at that point,
Just
this,
one?
I don't know how many, I know there was one that was
Do
multiple
we have
hundreds
an
of
amount of
dollars.
what didn't get picked up? What's that outstanding? Is a couple $100s, couple thousand?
No, that
It
that
was,
one request was,
Roughly what that, I'm ballparking my numbers, but it was the request that was, what the charge would be $1,300. The amount of staff time put into it was over $10,000. It cost the department $10,000 for a staff member to put that information together.
And
I don't know.
Stop it, guys, stop it, guys, stop it, everybody, no ma'am. Everybody, Ms. Stidham, you have the floor, please
Thank you.
continue.
Okay, well, that's significant amount, and that was my question, was this just willy-nilly, or, so was that the only time it happened, just one time?
It was no, it's not the only time that we have completed for people who have said that they would pick up a request of the price. But one thing I do want to mention is that was the last time that we did not have a individual from the public pay for a brokerage request prior to doing the work on it. So that work was all completed, that work was all charged, and we were never compensated.
Okay. Well, and I have no problem with moving forward then. Not saying that people can't get the information, it's just like come up with an estimate, at least pay half or something, you know, get it down. If it's something over, yeah, say if it's over 500 or even $2. I just want to make sure, you know, because I know that people make sure that I'm not like agreeing to, hey, you didn't pick it up. I don't know, you had a car breakdown or whatever.
I totally agree with that. That was an excessive amount, and
That is
but it
excessive.
was a lesson learned, and so.
I agree.
But most commonly, it's maybe $10 to $50
Okay.
tops for a subject.
I would be happy to set an amount, yeah, if it's over 200, we got half or something, you know, that's an excessive amount. But not just a blanket statement that you can't get one again, but. That's big. Have they requested anything else since then? Okay. Appreciate it. Thank you. Everyone.
Ms. Henry.
So on C, I think what I'm hearing is a lot of concern about legal staff immediately forwarding, the COR will immediately forward the CHC legal staff. So I think that statement just needs to be changed, that it's up to Jetty on, if it's a simple one, that's not a question, she can fulfill it. If it is a question, then she knows when she needs to ask.
There are some that I know that we have no records for something that's another question. Those don't.
Right. And so, and then there's, you know, simple ones that are easy, and then you can have her check afterwards what needs to be removed. But you can probably make the decision on what comes in, okay, I have questions on this, or yeah, this is one I can easily do.
Comfortable making the legal decision because I am not.
Right. But I was saying,
Yeah.
needing the legal certain ones. So you're saying you aren't comfortable unless you have her look at every single request?
I don't look at the ones where there's nothing responsive.
Right, there's nothing responsive, so it's never go.
Okay, so you're already saying they don't, because according to this, they immediately go, so I think the wording just needs to be changed.
And by the way, so when there are exemptions that apply, I don't look at the nothing at times I look at the documents that we're sending out, is it their request for legal fees, and I take out the privilege information, because there's no way that Jenny's gonna know what's privileged in that document, what's not.
So I just think the C needs clarification to meet the concern.
I have four. Thank you. Couple of questions. One. Has the number of sunshine requests gone down? Over the last,
I was gonna say, give us a.
over the last year, well, I know there's been some other sunshine here recently, but over the last 6 months. Because we put a lot more on our website than we have before, and continue to put more information on it. I will tell you that I know within my county structure, as far as anything that comes through any of the directors, all that, any sunshine request that comes in there goes to the attorneys. Now, each individual person over there, each individual official they can manage their own how they want to. One of them got in trouble a couple months ago about some stuff they did and should have. So we gotta be careful about doing that. I would ask that we review and ask some of our local entities how they handle it, maybe another health department of how they do it with sunshine requests as far as what goes to the attorney and what doesn't. I would suggest that for sure any email request should go to the attorney. Or anything like that, any legal, real estate questions, contractual, should go through the attorney as far as any sunshine rules to that. 100%. All this other minutia, I don't, if it's just plain out documents that we're already serving, a lot of them should already be on the system. So, I mean, it should be very few sunshine requests going forward. As far as charging, and I'm gonna say this, and I'm gonna tell you that it hurts me when I saw it. I wish I would have kept it, and I didn't. But I know that somebody may have it. But I know back in 2020, somebody put on either email or text that the entire public should sunshine them to death. So they are bogged down in sunshine requests. Don't shake your head. I saw it. I saw it. I saw it. Yeah, well, it doesn't, one person ruins the atlas, correct? That hurts me enough to sit there, Ms. Davis. I didn't interrupt you when you were talking. I didn't interrupt you when you were talking, please. I'm just telling you that some of the things. We all talk about trust, we all talk about being transparent. We all talk about reaching across the aisle, trying to do this. Since I've taken this over, I've done nothing but work my tail off and trying to get this done. And I feel as though, to some degree, I'm not getting a handshake from the other side as much as I would like. Two-way street. We've got to trust one another. And when people put things out that aren't right, either side, you've got to stop. Just literally stop doing that. Stop jumping to conclusions. Stop thinking the worst. You know, the documents are going out that shouldn't. They're draft documents and they're getting spread out to God and everybody, and they're not the document that should be going out. Any information coming out of this department should be one or two people, but actually just one. It should be through the director and the department itself. We should get our information, once it goes there, we should not be giving our documents out that we have that are draft documents, folks. Really shouldn't be. Okay, especially, but from now on, I told attorney, director, everything we have, a resolution, any document that comes for us to vote on, will have the word draft on it. So everybody knows it's a draft copy and not to be distributed, please. Because that's what causes issues. That was causing misinformation. Causes this to go silly on us. I don't have a problem putting this back. I'm gonna request that we remove the two motions and then we put this on hold for another meeting and get it reworked. Now, with me saying this, is that you're gonna remove your motion, correct? Now, I'm going to request, well, I'd like to make a demand, but I can't demand my own trustees. Request that any changes you would like to have on this, to forward them to myself, please. To me. Forward to me, and I will forward them on. Okay, you good with that?
Yes, sir.
Please do that. I asked that last time. Let's do it this time. Let's see what changes we need. I think we need a policy. I think it's gonna help cover over us. And we'll see what we can't do about melding this together. Okay. We're good. Now I'm moving on.
Mr.
Alright.
Chairman, there's something on the floor, so can we deal with that?
What's on the floor?
Wasn't it first and second?
We
You
moved to the first and second. We're moving on from that.
Don't need a motion.
Word.
no, the original people who moved can withdraw their motion.
Would you withdraw your motion?
On my motion.
Okay. You withdraw the second. So the motion's moved from the floor. Sorry, I apologize. Thank you for that clarification. All right, next on the line of business is process of procedures discussion. And who wants to roll on this?
Is this open to anything?
Processes and procedures. What do you want to discuss?
At the meeting that we had last week. Susie, of course, you're on vacation. I just want to ask the question. Who knew that the Aspen program was converted to a 501c3 before the meeting? Who knew that happened back in March? Were you there?
I apologize, I didn't know, am I allowed to respond the next day?
It just board and administration.
So as far as that, there have been multiple presentations for sustainability and the opportunity for things such as 501(c)(3) have faltered. As far as the information for the process of putting in for a 501(c)(3, we were told that would take multiple months. It could take up to several months as a process. And so that process was began. I had, as far as the, bringing the information, this is not, the 501(c)(3 is not under the health department. It is a separate entity, so we do not have to approve it. We did not have to approve its making, and we were not involved in that. So,
But the board had to give approval for you to be able to make it a 501(c)(3), correct?
That was.
We just voted on
We
that.
did that on the 15th.
we made approval for it to separate from the health department.
Right.
They do not need as a state.
We approved the transfer of the IP and the transition plan to move that program that was grant funded away from the health department so that it could service individuals outside Jefferson County through a separate corporation that we did not create.
I felt in the info in here that who knew, you know, trustee deal? No. That back in March, it was converted to a 501(c)(3.
No.
Or what the application was, and you think you didn't even.
Like I said, I already told you, I think it was June, and I know something was said in passing. But that's,
So this happened, my point being transparent. I know it happened before I got here. But none of us knew.
What happened?
They're good filed for 501(c)(3) to make it an Aspen network, what we met last month. That was done on March 9th. So if it takes months to happen, then that happened literally as soon as we started the program, is how I'm looking at it.
That's incorrect.
No.
So
So if it was, no, hold on. If it was done in March. And you were told that it takes several months in order for the application to go through. Several months, then it probably started sometime in December, or January.
no, ma'am, it's not. So
Okay.
as you've obviously taken a look at the papers online for incorporation one, they are not our papers. They are the papers of Aspen Incorporated, which is a separate entity from us. One, two. That.
No, I'm
the
looking at
paper-
from the
no,
Secretary of State file was done on March 9th by Derek.
Again, I'm not involved with Aspen Inc. So I do not know one.
Well, I don't know anything about it either, just found out last week.
That what I find difficult is that you were one, not ambushed. So the information was sent out to this entire board on July 18th. That was 25 days ahead of the meeting on August 15th.
I have the floor.
there's the questions are going back and forth. The question was asked. So there's a response.
I wasn't under the impression, I
Be
guess,
civil, please,
I'm-
both of us.
But can I finish before?
oh,
Civil. Just tell me, that's all I'm asking.
So July 18th, the meeting request was sent out to the board and said that we had a couple of dates, we need to set a special board meeting. The purpose of it was sustainability of the program, the purpose being that we figured it would take, we wanted to give as much time and ample opportunity for people to ask questions as they could.
no,
And we sent out-
I think I misunderstood, I'm sorry.
I think
I'm going back to March, this 501(c)(3) that was set up. That it was already pre-planned to branch off from the health department. It's not like Ms. Brown in our meeting. It's gotten so big that we have to branch off when we need more funding. You've already done it in March. I have the document from the Secretary of State that it was a 501(c)(3) by Derek Good that was filed.
So ma'am, again, what I would like to say is Aspen is a separate entity from justice. And so, no, I just Aspen Inc. So when you were talking about what was done in March, please do not look at Jackie and go, you created a 501(c)(3) in March. This is a
Did
separate
she know
entity.
about it
Miss-
that it happened?
Miss Sitter, ma'am,
tell them.
thank you. The Bible, as we have talked about in Act 1. I would like to address the fact that there has not been any blindside or lack of transparency. We have brought this program to this board, done numerous presentations on it, put down numerous things to the public, as well as posted all of them, as well as posted all of this on our website and given it out in multiple sunshine requests that have been requested. This is not, we've done everything we possibly can to inform the community, up to and including presenting on the grants.
Not
And what the
disputing
grants
any of that.
So then there is no justification for saying that my staff have blindsided this board with this decision. We have talked about sustainability this entire time. The Aspen project, as it was started, was a beta project in 3 schools. That's why you guys complain that, oh, it's only 56 people. Beta passed 3 schools. We are now getting ready to look at 9 school districts across the county.
But this is my
This
program,
has to- This is not.
but we are, so how you apply, we are doing that, but.
You know
this
what?
is
It's a little hard not to be extremely proud of the staff that has busted her ass for the entire pandemic and done this together.
Right,
So
right. Let's-
I will pull that back. But
Let me make a suggestion, please. So. I know we're part of the problem occurred, and I didn't. I should recognize it, so I can take some of the blame as well. Was when the agenda went out. And it wasn't, we didn't have the name Aspen on there, it had it's intellectual property instead of having Aspen. So I'm sure that was a major part of the mess up, and I'll take that for not going, hey, that clarification. So I will take that, blame it, all right?
so quick question, do you know, I apologize, when you say IP, people have said they didn't know what it was. There were 25 days to ask.
I understand that,
and clarify.
but let me just say that acronyms are always tough on people because different acronyms or it's acronyms of the same thing mean different things in different fields.
Correct.
And, IP, intellectual property or internet protocol. So you have all those different denominations or acronyms of different meanings across different settings. So we need to be very careful on our stuff. Like I said, I'll take that. Put it on me. I should have saw that and been aware of it. So I'm gonna take that part. As far as any of the other structural stuff, I know that nothing went through me. And I don't think anything went through anybody here as far as any development of the 501c3. I knew that there was discussions talking about looking to expand it out and expand out from this county. Quickly, and when we talked about it, they even went to the state doing some presentations and got a lot of accolades. That it was going to need to come out from underneath us because it couldn't go outside the county. So
That's the first I've heard of that part.
Mr. Davis, how many meetings and presentations?
Hold on. It was, I know I stated it in one of them. And I think it was one of the first meetings when we were turned a different direction. I said, wow, this is gonna go statewide, isn't it? It was yes, it was the answer. And that's what we were sitting over that one. So anyway, I think there's some things we need to put in place, and I got some ideas moving forward as far as some of the process and protocols, some things that we need to lay out amongst our board here. And that'll be the next session. I'm gonna hand them out and I want to get feedback. But I think we need to do a lot better job on information moving forward, what's doing this. I know there's a lot of questions that I would like you guys to work on answering those questions. Okay.
And we are planning on putting together a frequently asked question template so that those kinds of questions can be distributed where anybody who has questions could be able to look at those about how the transition is forming. But this process went through as we would any other process going through the department. We set up a special meeting to discuss it. The legal committee was given the 2 documents to review prior to the meeting. The recommendation, we had to wait for the board to get, we had to wait for legal, approval of the finalization of the documents. Those documents, as soon as they were approved, were sent to the board for review, and they were brought to a meeting where ample time was set on an entire agenda to discuss this and to be able to ask questions. I just want to finish my sentence, please.
This was back in March.
Just let me finish the sentence. Well,
Hold on. Finish your sentence and
thank you.
please.
But ample time was given on the agenda to address this, to the point there were crickets when we said, does anybody have additional questions?
Thank you.
That should be enough time.
It is,
Stand up,
it was not what's in the packet. Because you had to get the board approval to release it. It was what was done in March before the election. And I know during my campaign, there were multiple questions, and I know in our Q&A, we brought up multiple times. How is this gonna be sustained after if the grants run out? Never heard anything, because I know there were a couple of the staff that were in on our questions and answers that didn't say, hey, it's gonna probably need to go to 501c3, because it already been done. It was already done before I was elected here. Now it's back.
I
in
knew
March.
nothing of it till I was on.
And that is what I'm upset about. So that it was. It was already done before, it's not about what was in the packet, it wasn't about if I understood it, it's, I don't. Trustee Deal's been doing this 20 years, Mr. Pig's been in this, you've been in here for a while, you do corporate management, you know, and healthcare, and Susie's been here a couple of years. I'm still new and trying to figure out how this works. So when something comes at me, approve intellectual property, when we were here at the town hall meeting, someone told me, and I can't remember who, I asked like a blanket question about it, and they said, yeah, it's just a review program that are either working or not working. So I thought, on the premise, I'm like, and I was, okay, well, that must be something about how the programs are. And I kind of went through this, and I'm like, okay, and then now the packet. We knew they had the meeting, I didn't get the ask them packet till 5:38 the night before the meeting. I had it 20 hours.
It was sent to you immediately as soon as we received approval.
Okay, well, so to say that I had it 25 days, I had it
You
less.
had 25 days.
I did not
Ask what was.
Mr. Pig, can I ask a question? Whenever you said you want something drafted for procedures, what are you looking for? Because if it's procedures as far as how Aspen is going to provide
No.
the service, what are you looking
This,
for?
me, this is gonna be something different. This is gonna be internal for us. to do.
Okay.
Says this is really something that I've ever since I've actually gone on sport, I've had a little bit of an issue with, and I'm going to attempt to address it.
Right.
And that goes back since I've been on the first time I was on this board. So I want to take this opportunity, since there's a major opportunity to work on that. All right. Is there any- is there any-
I didn't know until the night before.
all right, thank you very much.
Honestly.
I,
Thank you very much. Can I make a comment?
yes, sir.
Okay, and this is regarding process procedures. It's not about that at all. But we continue to have these questions and concerns come up in board meetings. And I think that a lot of them are because some of the board members aren't familiar with standard procedures, how things have worked in the past, whatever you want to call it. And it concerns me that in public meetings, people are getting incorrect our information if it's not true. And I think we need a way to discuss, and if people aren't aware of something, that's fine. We need to discuss that, but I don't think it should be done in a public meeting where incorrect information gets put out. And even if it gets explained or corrected, people seem to only consider what was originally said. And again, I'm not, all I'm saying is there are things, this is a complicated business. There are so many players involved in this. There's so many legalities involved in this that it takes a long time for people to understand how all of this works together. So again, I'm not, public may not know it, new board members may not know it. I have no problem with that, but we need a way for people to become more knowledgeable about how things work. And the thing is,
We're gonna try and do that with what I've got here, okay?
okay,
I think I'm right on your target with that. Is there any discussions about other process procedures that we haven't already discussed?
Okay, may I please request that, all of the trustees utilize the existing procedures that are in place to present information to the board and for the employees review through prior to board meetings in order to be able to have the items available and in format to be able to be presented in final form for the next meeting as requested, rather than bringing them to the board meeting to make a stop on it.
Okay.
Thank you.
That's part of the thing here too. Any other? All right. Close that one, go to number 3, entertaining topics for the next agenda by trustees. I know we should deal. Pre-warned me one that he had, we should put that on there still with the deal.
yes, the personnel committee would like to put an item on the agenda to discuss the director's contract.
All right. Is there a second to that?
A second.
All right, it'll be on there. I have 2 items that I'm going to hand out to everybody right now. These, pardon me?
Is this homework?
It is homework for next night. That's where we're going with a lot of things. I'm going to ask that this not be given out to anybody else until such time. 3 that way. Please. It's a draft form. Give around there. This one's a resolution. You can read through it. And I think this will solve some of the problems that we're looking at, maybe most of them. Hopefully we'll get that resolved. Take your time, give me your feedback. Next meeting, it will be on for approval. All right?
Not for discussion.
Well,
Then
discussion and
the
approval.
following meeting.
No, you're going to look at it now, please, give me your feedback. As I'm asking you to do. And then it'll be on there. At least this one. Through that way, did you give one, Mr. Deals, give one to the attorney, please? Which one's it? This one's the directive I want to look at. Now, I don't want to see it on Facebook. I don't want to see it on anything. Please do not copy it. Please don't send it to anybody else. If I see it someplace else, I'm not going to be happy. And trust me, I am not on Facebook, but I see everything. I see what's going on. I see a lot of things. Trust me. Some of the issues that have happened, some of the issues that occurred, that I was getting beat up on because I worked for nursing, I saw all that. Don't appreciate it. This is incorrect information that led to that move. I should have abstained. That's crazy. Okay. So I'm putting those 2 on the agenda for the next meeting. Homework, and I think it's good homework. I don't think I'll feedback. We're gonna look to push them forward. Now, neither one of these, just understand, they have not been vetted by the attorney. They're gonna have to go through her. Obviously, get an eyeball on them to make sure it's legal. All right. All right. We're gonna move on now to public comments. This, yeah.
Actually,
Woo, lost my head. I wanna, how many cards did you get?
So there's two that are here that would have signed in, and we received one from online.
So, this first time we've done this in a while, do you have a timer? Or do I need to time it?
If you could time it, that would be helpful.
Hold on 1 second while we get there.
I'll be ready next time,
Let's see, here it is.
or actually,
And- Okay, now it'll be 2 hours. All right. 5 minutes. So. Thanks, everybody. Be civil, right? Process, policies, procedures. Please don't get into people. All right? Leave people out of it. Who's the first one on your agenda?
first one on the list is Penny Waddle, Waddle, okay, sorry.
Please step up, give your name, and when you say your name, I'm gonna start the thing and I'll start for you.
My name's Penny Waddle. My husband and I pastor a church in High Ridge, Missouri. I'm 73 years old, he's 78, so we're probably the most experienced people here. So what I say is gospel. So anyway, the Bible says that you're supposed to help people with their body, soul, and spirit. There are a bunch of ministers walking around praying for our county. They meet together and pray for each other, for their churches. You know that most government was started with prayer, so it'd be nice. The question is, have you considered having prayer before you meet? And the other thing is, if you get into conflict, take a minute, pray as a group. So I want to tell you my history just for a second, and I'll ask my questions. I didn't have any comment there because I wanted to listen and I knew I'd have some questions. So my husband and I moved to Jefferson County in '82, started a church, started a Christian school of people that were in our church. And the police came to the door shortly after I was running our school. There was a girl who was escaping an alcoholic dad. Her and her mom were staying with us. Police came to the door and said, "We heard you're a cult, you kidnap kids and you're brainwashing." So I immediately said, I prayed for a second. So I told the policeman, "Do you want to meet this girl that I supposedly kidnapped, brainwashed, and we're a cult?" So he said, "Okay, I really love the police in our county. We should all work together as a team for body, soul, and spirit." Okay, so a lot of people in our church are sick. A lot of them are having mental problems, a lot are having spiritual problems. So here I am, new church, being accused, and I want to say, I'm a tough old lady, and I learned to not go by my feelings. If anybody has only being controlled by your feelings, you need to quit what you're doing that's upsetting you. And that's where we and our church, as people, if you want to be in leadership, you have to go by what the Bible says, by what's right, and not go by your feelings. So when you're being affected by your feelings and you're so overwhelmed that you can't do your job. I've been in this for a lot of years, and I've been accused of a lot of stuff. So I don't belong in this position if I'm going to go by my feelings. Anybody that can't control their feelings needs to step down from whatever they're doing. So all of you, I encourage you to pray before you come here, pray before you start. And then you're going to see some unity like we're praying for our county. I had 8 women praying for this meeting today. Guess what? You're going to have conflict. You're going to be challenged. This county does not trust you anymore because of what happened during COVID. Guess what? My church people didn't trust me. So we had a budget all set up. There were emergencies came up. My husband and I went ahead and made some decisions and tried, let me know how many minutes I have left. My husband and I are going to try to explain to our board why we had an emergency and we had to spend money for plumbing, for snakes coming in the door. Guess what? I got mad because I was being challenged. And I said, like you, Mr. Pig, let's just end this meeting. How many minutes do I have left?
You go. You gotta go.
Okay, so anyway, so I had a feeling of being angry and I said, let's just end this meeting. But I went in the other room and I prayed, and I've been praying for y'all during this meeting. Conflict is good. Look at all our debates. Don't be upset. There's a lot of people praying for you, praying for this board. Tammy and Mr. Pig are new in their positions. You're learning the ways. You're learning how to work with this board and all of those that are involved. And I'm telling you, I got excited when I was hearing these presentations, the youth working with a group on vaping. There's a bunch of kids in this county that are looking for somebody to guide them into doing something to get out of vaping and drugs, all the junk. And so anyway, I had a lot of questions based on what I heard. But I'm not going to make any comments. If I ask the questions, you won't have time to answer them. So can I present my questions? Who should I address them to get an answer?
They go to, usually it's a question answer.
communications@jeffcohealth.org. It's on our website.
jeffcohealth.org. I've been trying to read everything you have, and people put all kind of stuff in the paper. They're going to condemn anybody they feel like condemning. And I've been bombarded with emails and stuff that come to me. What do you think about what's going on in our county? You are addressed with a big mess. And you had to follow CDC guidelines, right? Those are guidelines. They aren't the law. And some people don't want to follow the law. So you run into that too. So I appreciate all of you. I am expecting good things ahead because we're praying for you.
Thank
I
you very
encourage
much.
you to pray.
Thank you. Thank you very much.
Next is Elizabeth Downer.
You ready? Name and address, please. Or just police name. Just
I'm Elizabeth Downer. I am in High Ridge.
There you go. Thank you.
Thanks. Had a couple of things that have popped up, but originally why I was here is because I do send questions to the Jefferson County. Okay, and I have asked for historical documents, which if you understand that in the health department was originated in April 1949. Okay, the board of trustees in May 1951 was started. In November 1952, the general election in Jefferson County, the board of trustees were elected. So you're an elected body. That makes you a public government body. Okay, as of our Missouri statutes, documents as in the bylaws, revisions of the bylaws are open to the public. Okay, our current bylaws say they were adopted in January 2021. Okay, were they revised? Were they changed? I mean, if we became a board of trustees in 1952, why can't I ask for the original copy? Why can't I see the revisions of those copies? Okay, those are public documents, right? Okay, those are public documents. Anything that has to do with the board of trustees is a public document. I can call up the custodian of records and ask for a time when I can come in and view those documents. That's in the revisor of Missouri statutes. Okay. On that. So my email requests, when I ask a question, those are answered. But if I ask something about a charge now, thank you for having the financial report on the website. But all historical financial reports should be available to us. Right? Okay, I'm just saying. Now, if I ask a question about a vehicle, a Ford 2023 Ford Maverick that was spent $25,000, I asked the question, what's that? Okay, I sent it to the board. The board sent my request to the lawyer, and that was charged $250 for her to read my email. I'm paying for that again. Okay. If I'm asking for a document and you guys are like, well, I don't know if she could have that, it gets sent to the lawyer for her to read my email for $250. And then if they give me a copy, I got to pay for it, which I've already paid for because I'm a taxpayer. Okay, so that's just my concerns and questions. That falls all under the revisor of Missouri statutes. Okay, I got them all highlighted. I went through because you guys reference it all the time. And the only thing that it says is if it's a private document, I don't have access to it, which I'm fine. I do not believe I'm asking for any private documents ever. Everything I ask for is public. If I go to the county clerk's office, I'm allowed to go into their public documents and look at all historical books. I'm able to look at old newspapers. I'm able to look at the county council books, all court records for this whole county. They are a government body. You guys have a custodian of records, same thing. As far as the Aspen website, I just want to make it clear. The funds, the 501c3 and all that, it still says on that Aspen website that it's funded by the Jefferson County Health Department. Okay, so we're not funding it. And the Aspen program has its own incorporation. There should be nothing about the Aspen program even on the Jefferson County Health website. Just saying. I have one other question. I noticed out in the book, out in the lobby, there's a book on vaccinations. Okay. There's a whole page like telling the parent, about it. What it doesn't have in those books is the ingredient list. Okay, for informed consent. You all are giving shots to these kids. I don't know if you've recently looked up ingredients and adverse reactions. All of that is informed consent. Okay, the adjuvants cross over the blood-brain barrier. Okay, and there's adverse reactions to that. So all of that should be in the books.
Thanks, Michelle. If you have one of these comments you want.
I did.
Somebody, sorry, go ahead, when you're ready.
Yep.
You
Okay.
start.
Yep, we're gonna start. So this one says, thank you for reading my letter. This is from John Giancola. I am delighted that the Aspen program is being transferred over to a private not-for-profit corporation. In-depth and computer-developed software models are difficult to create for a public entity. But it has been developed and $3 million of other people's money were spent to do that. I assume an audit would show hours of time and expenses billed properly. My understanding is most of the grants were given for this purpose and the grantors are satisfied with the compliance. Were there any state or federal grants involved? If so, how much? I am fine with all of that. The community, in my opinion, should have no complaint regarding the above mentioned. But what is not being accounted for, in my opinion, is the use of JCHD name staff, even if accounted for, JCHD name, staff, even if accounted for, goodwill, equipment, etc. It also misses that a system has been developed for $3 million, and in the negotiations to transfer all this, I would like to see the board at a minimum get services delivered for Jefferson County for 20 years free of charge. This is a $3 million asset, no matter how the money got there or who gave it. It just cost $3 million to build, and there are numerous entities possibly wanting to subscribe to the services and or participate in using the proprietary software. I'm sorry, but this has value. The terms of this agreement should be public prior to signing, and I am urging this board, its attorney, and management to consider what the value of this asset truly is and represent the best interests of the citizens of the county. I don't know how to value something like this, but people making $450 per hour should be able to figure it out. The program has good reviews and it just cost $3 million to build. So maybe this or another not-for-profit should be offering $3 million or more and give Jefferson County services for 20 years free. This could be the seed of a $250 million not-for-profit in 10 years, or it could go broke. But right now it has value, and I think that the county should be the recipients of that value, however that is determined. Thank you for hearing my concerns, John Giancola.
Thank you very much. All right, that concludes. Who they did, correct?
I am actually adding myself to the list.
Okay.
For public comments. We got me twice today.
Did you put your name?
All right. Your hand. Okay.
Go.
Thank you. Okay, so I'm speaking as a citizen of Jefferson County, but also sort of as an employee of the health department. I really just wanted to be able to address the board and the public and the numerous amount of Jefferson County Health Department staff that I know are watching on YouTube and their offices. I think it's really important that I agree with Miss Penny earlier about recognizing what we are as public health, what role we play in the community, and ultimately what it is we're all shooting for. I know that I probably sound very cheesy, and there are some folks that are looking at this saying, I don't believe one word this woman is saying. I know that. It's okay. I've had people tell me that. And I don't mind. If that's who I need to be in your story, that's fine. But it doesn't change the fact that technically I wasn't born in Jefferson County because my parents had me in Illinois. It's a big deal. But I was born and raised in Jefferson County. I enjoy what I do. I taught for 5 years. I never thought I'd be in public health. And part of my friends, I sure the heck never thought I'd be in public health. And all the other things. What I'm trying to say is, I can see both sides. That's the beauty of being in communications. I can see the public. I hear people are upset with us. I hear that they think we do things wrong. I hear that we don't do things the way that maybe we should and that they like. I also hear my employees who cry or who get upset. They're not my employees. I'm not director. My coworkers who are trying every day. They are not trying to be difficult. We are not. And again, I may be speaking out of turn, but from my perspective in comms, I get the emails that come through with sunshine. We're not trying to be ignorant. We're not trying to hide. I promise you, my thing in communications is transparency to the point where I'm trying to make the people that I report to angry because it is. I don't know how many minutes I have left. Okay, cool. I really just. I know I sound cheesy, but I do want people to understand, both our employees and the public. We are not enemies. We are not the people that we maybe are contrived out there to be. I can tell you I've worked in this health department for 7 years. I love every single person. Even the people that sometimes we sit down in a meeting and I'm like, oh, that's not how I would have done that. And they look at me and say the same thing. But at the end of the day, I know that they are here. And you guys know that because we've been talking about pay. We are here because we believe in what we do. We are, as an entity, as an administration, as a board, there's a lot in here that is set out in the world of socials, and that is part of my job. So I get it. Socials, part of what I do, but it's sometimes evil and it's misleading and it's not always accurate. And I will try as communications to continue, but I really just want people to know from the public that there is no true terrible intent. Nothing that we are doing in the health department, whether it's the employees, whether it's our administration, whether it's our board, whether it's our finances, whatever that comes to, I would bet everything I have that it's all in good faith. We are trying to do the best we can. Thank you for my 1 minute remark. It pains me to listen to our board argue, our administration. It pains me to hear our employees get nervous on board day, on days when we're supposed to provide things to the public. We're afraid sometimes that people aren't going to like us. And I get that. And opinions and feelings are valid. I'm not trying to dismiss anyone's feelings. I'm not saying that you are not entitled to not like us or agree with what we do. But I truly do hope that we just put it aside. And I don't have necessarily the religious part here that Miss Penny has, so hers sounds a little bit better than mine, but just know that we are humans that work here. All of us are, even our board members, even the people in administration that people may not like, down to the people in comms who answer emails and Facebook comments that you may not like either. There's no ill intent in that regard, and I would bet everything I have on it. And I just hope that we can just move forward in some capacity, because I want to be able to do my job. I want to be able to do it well. And I want people to know that I'm probably going to screw up. I'm not going to do enough justice for animal rights education. But that doesn't mean that I have something against big animal life. I just haven't done it yet. And I just hope that, I don't know, I kind of talked for a while here.
And I know some people will watch this and go, she's not telling the truth. I don't give a crap what she says, because I don't trust her. That's fine,
Thank you.
but please do.
Thank you.
Also, this is a very long board meeting. We need pizza next time.
I'm not ready to start on this.
Thank you.
So we
And if
do,
we can get this movie by, that'd be great.
That was it.
we haven't,
Thank you for your appreciate.
Yeah, to improve your minutes.
just a minute. I'm gonna make the motion to go into closed session. Pursuant to 610.0.021. For the only reason of approving the closed minutes of the last previous meeting. Second,
I'll second.
first, second, any discussion?
May I please see them now since I didn't get to be there?
You want- You can look at it, you can't, well, but anyway, all right. So any discussion on that, any discussion, all right, roll call vote,
Mr. Pig,
yes.
Mr. Deal,
Yes.
Ms. Stidham.
Yes.
Dr. Henry,
Yes.
and Ms. Davis. Yes.
You may want to announce that there's nothing to be done after we come out, so that we don't get back on the live feed.
I'm sorry, repeat that a little while.
Do you want to announce that there's nothing to be done when we come back out of closed session, so that you don't have to go back into live feed and say that?
Right, well, there's nothing we report average, for the minutes